Hello, everyone. My name is Simiran Chaudhary, and I welcome you all on behalf of Voice of Healthcare to this very important conversation on Breastfeeding Week. Focusing on postnatal support is not a luxury, it's a life saving intervention. And while much of the focus on maternal health ends at childbirth, but what often gets overlooked is the crucial period that follows the postnatal care. This week, the week after delivery, are not just a time for physical recovery but also for the emotional adjustment, infant bonding, and breastfeeding support, all of which significantly impact both maternal and newborn survival. And to help us understand why this postnatal support needs urgent attention and systematic integration, we are joined by Dr. Shweta Mehndiratta, Associate Clinical Director and Head Unit at Marengo Asia Hospital, Faridabad. Welcome to our show, ma'am.
Thank you, Simran. It's a pleasure talking to you here on this platform.
Thank you so much for joining, ma'am. We are looking forward to this insightful conversation and to bring this attention on postnatal care. Without any delay, I would like to understand from your experience, both as a clinician and as a leader, why is this postnatal support often underemphasized despite its crucial importance?
Because I think most of the females or their family members, they feel that pregnancy itself is a big challenge. So their entire focus during the entire 9 months is just on the pregnancy or on a normal delivery. They just want to talk about a normal delivery. They just want to talk about whether they'll deliver normal or by cesarean. They hardly discuss about when they come to me about what is going to happen afterwards. So, the problem is they are prepared for the delivery, but not for the challenges that are, going to come eventually. So the time has come when, when we are talking about pregnancy to a female, it is very, very important that we talk to her about the challenges she's going to face in her postnatal period as well. Moreover, I feel that these days we have mediclaims, we have so many things. So they also say that a woman needs to stay in the hospital for just 24 hours post delivery if it's a normal delivery, and 48 hours if it's a cesarean section. So people also feel it's a very, very simple thing. After delivery they are going to come back home. There is no challenge at all. So I think it is being underemphasized by everybody around us.
Definitely, ma'am. I think there is a lot of efforts, and that physical things change a lot when a woman gives birth. You know this much better, and I believe all the moms who are watching this knows this, and how much it takes, the pain, the mental trauma, or let's say the strength is required in this. That's a lot. And even after that, we normally don't care much about mother once the baby is born. So can you explain us how postnatal care, including breastfeeding support, directly impacts maternal and infant survival rate?
See, when we talk about postnatal support, we talk about the mother and the infant as a unit. So it's as you said, mother is coming out as a new, so two people are born at that time. It's the mother who is born and it's the child who is born. So two people are actually born, and we have always been thinking that only a child is born. But what I feel, two people are born at that time. So as a mother, she has to face a lot of challenges, like about bleeding. It can be heavy at times, and it can be underrated at times. She doesn't know whether she's going through heavy bleeding. Some people say, "Arey hota rehta hai." That is a big challenge for her. She might have infection in the wound area, like there is a cut if she has a normal delivery in the perineal area, or during cesarean, there is a cut, in the on the tummy. So both the things, whether it is a perineal normal delivery or it is a cesarean section, there's a wound that has to be taken care of, which is hardly spoken about. So as and infection is hardly talked about, and if she is already, immunity is low at this point of time for a mother, there's a lot of protein requirement by the mother. So one doesn't talk about mother in terms of all these things. And when we come to breastfeeding, we go through so many myths in the families, in the society. So breastfeeding in itself, it's very underrated talk of the town. So people say ki asani se ho jayega, but it's a challenge for sure. So once we take care of mother, we take care of the maternal mortality and the morbidity indicators of the nation. Once we talk about the child, we actually reduce the neonatal mortality and the morbidity. That is very very important in the under five aged children of the country. So so it has a direct, not just on the survival. So this survival has an impact on the nation's indicators at the same time.
Thank you
So
so
the
much for
baby, if I
explaining.
talk about,
Yes.
yeah, so the baby, if I talk about, if they are given breastfeed at the right time, in the right quantity, at the right intervals, they are properly nourished, it saves them from a lot of indicators like acute diarrhea. Their intellectual power also improves eventually. Under five, morbidity decreases. Uh, so there are so many things. Their immunity improves. So there are so many. The list is, it's not an ending list.
Definitely, ma'am. I think we call it the first medication, the first vaccine, the breastfeeding for the infant. I think it acts like a life saving medicine. It helps them to boost immunity. It helps infant, to generate all those antibodies, and it also strengthens the bond between the mother and the infant. And I think that soothes the new mother much more in in any other way. uh, but since we are talking about we are also focusing on the postnatal care, so if you could tell us what could be the key components of the ideal postnatal care system for lactating mothers in India, which we normally lack.
When we talk about the lactation, only once a mother herself is healthy, she can lactate properly. So for herself to be healthy, a gynecologist needs to, take care of her for the initial 48 hours. She needs to ask about, like how is her bleeding, how is the lochia, they like the discharge after the delivery, how is if she has any fever, if she's feeling weak. So all these things are, how is the pulse rate, blood pressure, her basic vitals have to be normal. Is she able to eat? Is she able to drink water? Is she able to maintain her hydration? During the first 48 hours, these things are very, very important. Once she learns to do this in the initial 48 hours, eventually, when she comes to us for the next 1 week, after 1 week for the follow up, we make sure that, we have counseled her completely fine. Like if she's able to breastfeed, she will have lots of problem, in the nipple area. She can have, she can have cuts in the nipples initially when she starts feeding. She can have cracks there, she can have dry nipples, multiple problems, that have to be addressed when a woman comes to you after 1 week. Breast might be engorged while she's feeding the baby and she doesn't know how to smoothen them. So she has to be explained about the hot fermentation. She has to be explained, about like if she's feeding from the right breast in the right position, if she's latching or not. The lactation counselors play an important role. So every hospital have lactation counselors these days who play an important role in this. The pediatrician plays an important role by, seeing the baby. If the baby has jaundice, maybe it is due to improper nutrition. If the baby is not gaining weight, maybe that is due to improper nutrition. Or if the baby is losing weight, for that matter, like 10% has is usually lost in the initial 1 week or 10 days. But eventually if we see that in the same baby it is more than 10%, we know that, there is some problem in the breastfeeding. So the follow-ups are very very important. Eventually, when the patient comes to us for follow-up, the patient might feel lethargic, might feel exhausted with just, patient keeps awake for the entire nights. So if you motivate them, like it's okay if you're getting up for 2 hours, it's okay if you're getting up after every 2 hours and you're not able to sleep, 8 hours at a stretch in the beginning of your. So gynecologist has to motivate that it's okay, it's part of life, it's the birth of a mother. So these motivational counselings are very very important to let patient establish the breastfeed, let the baby and the mother bond with each other. Once they bond, they learn how to stay together in this, journey together. Eventually we call them after 6 weeks again. When we call them after 6 weeks, we make sure that we teach them the contraceptive barrier so that they do not have accidental pregnancies, and eventually this baby doesn't get enough of breast milk. So, every visit that they're coming to us is very, very significant. Whether they're coming to a gynecologist, whether they're going to their pediatrician, whether they're going to their lactational counselor. So, all these visits are really, really important. I feel like that. And moreover, when they come to us, we have to teach them about the nutrition that they are taking, if they're taking appropriate, proteins in their diet. Because what they think is that if they will have so much of milk, they will be able to lactate properly. But it's the proteins, it's the hydration that is very, very important. And what happens in the family is that the family doesn't tell about these myths when the patient is pregnant. Suddenly, when the mother is born, she comes to know that there are so many myths that are running around her. So, whom should she discuss these myths with? And it's the gynecologist who has been seeing her for the entire 9 months now. And she easily discloses that these things are happening in the family. Are they healthy? They are not healthy for her. So it is, very, very important that you have a good rapport with your patient when she is coming to you for the follow-up visits. Because it is not just, you just see the wound, you say, tell everything is fine, you can go back. It is not about that. It is about so many things in this particular, entire journey that have been hidden. And she can now come to you for the counselings, whatever she needs postpartum. She might be having depression at that time, because she's awake the entire nights. So how to save herself from this postpartum depression also comes in these follow-up visits. Until unless she is healthy in herself, she will not take this journey strengthfully. So this journey of breastfeeding,
Can you hear me, Dr. Shweta? Hello?
yeah.
Yes. So we lost you in between, but we just understood the entire journey is so different. So, there's so many components involved in it, and how beautifully a new mother needs to be taken care along with the infant. Because if mother is, being taken care, automatically the infant will be happy and well fed if the mother is being taken care properly. And it's an entire journey of learning every day, every week. Like you said, the mother learns something new, something another new things comes up and she's learning. And like you said, ki, earlier we do not talk much about all these things, and now slowly and gradually when they come up into this journey, there's so many myths around, which only I believe a doctor can burst all those myths. Because clinically, scientifically, what is right, what is wrong, we need to get that approved and attested from our doctors only. And that's why we want to create awareness around this sensitive issue on this special breastfeeding week which is going on. So in your week, what should the first 6 weeks after the childbirth look like in terms of the structured medical, emotional, and nutritional support? You just kind of give us a glimpse around this also.
Okay. So how I structure it in my way is that when I structure my first week into first 48 hours and divide the rest 48 hours for the next 5 days. That's how I do. So the first 48 hours are very, very critical. In that, the colostrum is released in terms of breastfeeding, and at the same time, it is very difficult, especially for a new mother who has been, who has delivered through a cesarean section to feed the baby, and she has to, she needs a lot of motivation, and she needs a lot of care at the same time. So this 48 hours are very, very crucial. After the 48 hours, during the initial, 7 days, her nutrition is very, very important. Her bleeding is important. Her infection should not be there. The wound healing should be there. She should not have fever. At the same time, we see the infant well-being also, whether the infant is able to suck, latch properly or not. Eventually, I feel that after the first week, when the baby is at home, I have to make sure that the family. The family also learns how to take care of the mother and the baby as a unit. So I make sure that the family is giving rest to the mother, appropriate rest is being given. Along with that, society, they should not visit too often to the newborn baby and the mother during this phase of time, and they should not support in spreading the myths. At the same time, we have to make sure that the vaccinations are done, the mother is not going through any postpartum blues or any depression. Her breast care is very important after the second week, because now the breast can be engorged if not fed properly. So we have to see the breast care during this phase. After that, when we see that the mother is recovering after the fourth week, we talk about the contraception. As I told you, we tell her that the lactation, when she is feeding the baby, this she can have, she can ovulate, she might not ovulate, she can have erratic ovulation. And during this phase, she can, if she comes in contact, she can have a, pregnancy. So she has to take appropriate precautions. So we counsel her regarding the contraception. We also counsel her that it is not necessary that she has to eat too much to feed the baby now. She can have a balanced diet, should be rich in proteins. Adequate diet is very very important during this phase. She should not consume excess sugars because suddenly her appetite might start increasing. So whatever appetite she has when she is feeding the baby, it should be fulfilled by the proteins rather than by the sugars. That is something that is very very important and scientifically supporting thing that we have to tell the patients and the family members as well. Again, after the fourth week, I tell patient, move out of your house, start having a walk. Eventually you can have some stretches or something, so that you immediately, postpartum, you recover, and you did not wait, like after 6 months when you go back to your work, you think about like if you have gained a lot of weight or anything. So this is how it goes weekly.
It is very well planned, ma'am, and we really understand that how each and everything is planned in a very scientific way, and all these components are very important to educate the new moms and the family also. Uh, in terms of the self barrier, when a new mom is, she is going through this journey for the very first time. So, what could be the most common barrier women face in accessing this postnatal supports, especially in this urban area and semi-urban setups?
I think whether it is an urban setup or a semi-urban setup, the problems and the barriers, they almost remain the similar. Matlab, I don't find any basic changes in the barriers that they go through. So basically these days, in urban setups, most of the patients who are coming to us in the corporate hospitals, they have mediclaims. So they find that 48 hours are enough for a cesarean and 24 hours are enough for a normal delivery. So what I feel is that those 48 hours, maybe the mother has not learned anything, and because of these policies, they are they are running short of what more they can learn once they reach home. So other thing, if I talk about semi-urban areas, as you said, in the families, I feel they are not that much connected with the doctors that they can ask for everything. They are not that trained as a doctor is. They have their own opinions how to handle such problems a woman faces. Again, the problem is, if we go a little more backwards, I feel that there is a lot of literacy gaps. you know uh, like a patient herself may be educated, and maybe the family members, they are entirely from a different background, the where she's rearing her child, and maybe there are so many myths that are around her regarding the breastfeeding. That might be a barrier again. What they want to feed her, maybe she does not like what she wants to eat, and she's not able to communicate. So communication barrier is there, literacy barriers are there, policy barriers are there, I feel. And at the same time, I feel that uh, uh, her postpartum depression or blues in itself is a big barrier, which it is very very underrated. And I feel, if I ask any woman who comes to me, I feel she goes through so much, because she sees her bodily changes, everything in her changes once she becomes a mother. And it becomes so weak for her to look into the mirror and accept her as a mirror. during the initial few weeks of her life. Her whole scenario changes, and at that time, if she is not motivated, if she is not having a family or the society who is supporting her, or a doctor who is supporting her, it is very very difficult for a woman to breastfeed and give positive feeding to her baby at the same time, because the baby needs what? Baby needs all the positive energies. So that positive energies can come only through the family members who are surrounding this mother and the baby. So once, earlier what we used to think is that baby is a unit. Then we
Hmm.
got to know that mother and baby are a unit. Eventually, we came to know that parents and child is a unit. But today, when everybody is living in a nuclear family and suddenly they call their parents or parents-in-law to support, they then has come an era when this extended family has become a unit. And now I feel that there are families where where parents are not able to come, parents-in-law are not able to support. I have seen those situations also. And then the society's roles comes into play. So there are japa maids that are available these days, who know that how much care a mother needs during this phase of time. So they are ready, and I have seen people appreciating these japa maids so much. They really like, because their barriers are crossed because of
Hmm.
this new trend that has come up. So I feel it's not a bad thing if my mothers are happy and they are making my children happy.
Definitely, ma'am. It's the best thing which they can do, and because of like you just spoke about that nowadays people are living in nuclear family, and if parents or in-laws are not able to come, then we have this new Japa maids like you mentioned available. That can help in that difficult time. That can make the mother happy, and all those transitions which a mother goes through in this journey, seeing herself in the mirror, changing the entire life. There's no space of her own. It's all about the baby. According to the baby's sleep schedule, she has to sleep, and accordingly she has to feed. So whether intentionally or unintentionally, she has to do this, and that makes her kind of somewhere feel lost. And in this situation, in this journey, the family support, the societal support, and if the doctors are always there to support them, to make them understand, and uh, just to make them feel heard. I think that's the best we all can do right now at that point of their life. So I think half of the care is being done there, and then family support is always there. Ma'am, like you also mentioned about the doctors
So
training
true.
and everything. Thank you so much, ma'am. And like you were also mentioning about the healthcare providers training and everything. So, do you feel that healthcare providers receive enough training in postnatal lactation counseling, or there's still gap in our system?
I feel there is a lot of gap, because the proper training and everything, it requires a lot of time and lot of experiences. So what happens, when we are in the hospital, so we have doctors who want to train, but they have so many patients. So they hardly give that much education in that short span of time. Then came the lactational counselors. So they have hardly much delay. But the woman is never heard of at that point of time, when when a woman wants to say what problem she wants to speak. Then comes, like, there are asha workers, there are anganwadi workers and all, who go for immunizations and everything they want to discuss. But the training that they have received, I feel, is not enough. So I feel like, uh, according to the mother, when she was 9 months pregnant, had they been visiting her, listening to the problems, now also, if once they have delivered, they listen to them, they get hold of the problems in every core of life that a woman is facing during this phase of time. And then an appropriate training would have helped them to train the mothers also. If we see abroad, outside our country, we see, I have many cousins abroad. So they tell me that they are the nurses from the hospital themselves, they are visiting, the midwives and all, they are going to see if nobody's bottle feeding. At times, we cheat, the mothers cheat. They give night they give the bottle feeds to the baby during the 6 months exclusive feeding. So by feeding, they are able to catch very easily because they are trained so much. In India, we don't have any follow-ups that we can go, we visit the places and we come to know whether they are actually exclusively breastfeeding the babies or not. So I feel that there are so many models that there are so many studies where we have seen that telephonic follow-ups can help. The AI has come up where we can come to know so many things. Then why we are not focusing on this area which is going to help each and every child who is being born, and this is going to be the future of the nation. So programs have to be run which are properly projected and properly trained, so that we can help these infants to have exclusive 6 months breastfeeding in a proper way to fill in the gaps that are existing.
We definitely need that at large scale, ma'am, because what even I also believe that there's lack of awareness. And like you also mentioned in the starting, people normally train or educate mothers about, whatever the month is going on, whatever the time is going on, but nobody trains them about, or they train them about the baby. But no one talks to them about how they have to take care of themselves, because our early generation was not, focusing on that part of the journey. Now the time has changed. We need a lot of mother care with the infant care. Uh, and that gap needs to be fulfilled. That needs, I believe, a public private partnership where the government can also pitch in, so that the healthcare providers can pick up all those modules. And like you also mentioned, that these children will be the future of our nation, so they needs to be properly taken care, and the mothers as well, because that can lead to more serious issues in the future. uh, Finally, ma'am, as we are coming end of our discussion, what message would you like to leave for new mothers and for the system around them that must evolve to support them, and so that we can create more awareness on this postnatal support?
So I feel that since last few years, when we celebrate a Women's Day, we always talk about mothers' empowerment. They are the free to make decisions of their own. So once when they are becoming would-be mothers, during that phase of life, they should become strong enough. They should strengthen themselves that whatever they face, during the postpartum period, they should be free enough to discuss with the people around them, and they should put in their points whatever they feel like, and they should remain heard of by the people around them. And instead of giving suggestions to such a lady who is already suffering, we should make sure that they are more of heard than we give them the suggestions, and they are more of they themselves, their journey should be an inspiration to the next woman rather than we motivating them. So that's how it has to be done. I feel that if every woman who becomes a mother, she feels that I have to become an inspiration for the rest of the mothers and I'll fully breastfeed my baby. uh, Nobody has to motivate her, and she will become a motivation for everybody around her. So let's support each and every mother in our when we are around. And it's, I would just say that it's not just about breastfeeding that I want to talk about. I want to say that even when our children are growing, and we are working mothers, all of us who are working mothers, we have to make sure that if there is a mother in the neighborhood who needs our support, we should be willingly helping her. So the journey starts once we all women held hand in hand, and we make sure that we are going to raise each and every woman around us. So everything is linked, whether it is a Women's Day, it's a Mother's Day, it's a breastfeeding week. So it all has to come from all of us, because the hindrances have started once we all have started working as a working mother. So we all have to support each other. So the working place has to be the first place. The policies have to be such that if a woman becomes pregnant, her promotion is not stopped. If a woman is breastfeeding, she gets a maternity leave completely. if a father needs a paternity leave for, the mother, for supporting his wife, he should be given that paternity leave as well. So that is my message to the society, that we all have to support each other in running this week a successful week.
Very rightly pointed out, ma'am. Maternal leaves, maternal support, as well as the paternal leave is also required uh, and needs to be focused on, so that the father can support the new mom and the kid at the house. And like we also discussed, nowadays we are living in nuclear family, and that a single hand support would also means a lot. And education, sensitization, and awareness through each and every day, whether we are discussing about women's day, women's could be the new moms working in, or the working women's, or the would-be mothers. I think that education needs to be given at each and every step, so that we can educate as many as public audience, moms, and the women out there. So thank you so much for creating this awareness with us, ma'am. It means a lot it means a lot that you have come to a platform sharing your expertise and experience with us, with our audience. Thank you so much, ma'am.
Thank you. It was nice talking to you.
Same here, ma'am. Thank you so much.
Okay, bye.